Hi, this is Nina. I'm a medical consultant in the New England area, and I'm excited that we have released our new Fit Food Lean Collagen. It is a product that contains 15 grams of bovine collagen peptides, as well as a novel dietary ingredient called beta-hydroxy beta-methylbutyrate, or HMB, and this is a metabolite of L-leucine. We also include 500 IU of vitamin D3. So this is a product that is well placed for individuals who are looking to increase or at least maintain muscle health, especially in individuals who are ages 60 to 60 and older, really, because it shows that it prevents muscle loss. And of course, sarcopenia and muscle loss is a condition that is associated with aging. So this is a great product for longevity, healthy aging, etc. Of course, we know that the average person loses between 8 and 15% of muscle mass each decade, and that's after, say late 20s. So it really is a potential concern for most individuals, not just individuals who are elderly. But this particular product was studied in the majority of patients ages 60 and older, and found to be very helpful in preventing muscle loss and actually helping to increase lean muscle mass. So this is, of course, a great visual on what a healthy muscle to fat ratio looks like in a young man. And then this is an age 66-year-old individual, male, who certainly has the condition of sarcopenia, where you have a lot more fat. Sarcopenia is also known as skinny fat, which is or TOFI, which is thin on the outside, fat on the inside, potentially. You don't have to have, a large phenotype in order to have sarcopenia. So this is potentially, sarcopenic male, where you have a lot of fat in kind of marbling the muscle. And so we want to avoid that, because it's is potentially detrimental on the bones, but it's detrimental to a lot of things, because muscle is really how we dispose of sugar. So sarcopenia can certainly lead to blood sugar dysregulation, prediabetes, diabetes. It is, of course, we store, blood sugar as glycogen in our muscles, and then muscle excess or adequate lean muscle mass actually is very protective against pathological conditions, chronic diseases, and even cancer. So this is interesting because osteoporosis has been diagnosed as a disease. It's been recognized since 1994 as a disease. Sarcopenia was only recognized by the WHO in 2016 as a disease, but the good news is that it's being recognized as a condition that is prevalent, and really early diagnosis of sarcopenia could potentially even stem the development of osteoporosis, because healthy muscles means healthy bones. So I'm going to show you a couple of quick studies, just an overview on HMB. We know it supports protein synthesis, it prevents proteolysis or protein breakdown. It helps improve strength gains from resistance training, it increases VO2 max, and then it turns on mTOR, which is the anabolic pathway, mammalian target of rapamycin. So here we know that, supplementing with HMB is really helpful, because in order to benefit from ingestion of leucine, really only 5% of leucine is converted to HMB. So you'd need to consume 60 grams of leucine in order to get 3 grams of the HMB. And we know here through a variety of RCTs that this is a meta-analysis, 11 human clinical trials. Those who are weight training and took HMB had double the lean gain increase in lean muscle mass each week over the placebo group. So this is a study looking at 35 elderly men and women. So those are individuals around 70, 75 years of age. They took 3 grams of HMB for 8 weeks, and they had a significant improvement in their functional ability, or their get up and go test, which, as we know, is the test that really helps keep people out of nursing homes and living independently if they can get up and go out of a chair. This is an individual study looking at 70-year-olds, 3 grams HMB over 8 weeks, improved body composition. This is looking at 2 different groups, those who they had a non-exercise phase for 24 weeks, and the individuals taking 3 grams of HMB had an improvement in strength even without resistance training. Then both groups did resistance training, and the 3 gram of HMB group had the best outcomes. This is great because we know that HMB from this study study prevents muscle loss during bed rest. This is 10 days of bed rest, and the HMB group really preserved their lean muscle mass, especially compared to placebo. And so this is great. Think about it for individuals who are post-surgery, who are ill, and certainly a better option than what is typically prescribed or suggested, which is Ensure. And then here is a reduction in muscle loss in those with stage 4 cancer. So again, this is the product Fit Food Lean Collagen. It tastes great. The flavor is mocha latte. And this is the amino acid profile. The proline in this helps to support the body's natural enzymes that support collagen synthesis. And so it not only is that you're consuming protein from collagen, but you're helping the body to produce collagen for connective tissue. And again, the HMB and protein in general is going to support the lean muscle mass synthesis and prevent proteolysis. So the amount per serving at the MSRP of $66.45 retail is $4.70. So again, tastes great. It's like 3 products in one, with the 15 grams of protein from collagen, the vitamin D3, and also 3 grams of HMB. So thank you, and I hope you give it a try.